Hello and welcome to everyone today. I don't know if it's sunny where you are. It's sunny where I am, which makes me very happy. We're so thankful for you to be here and we want to get started right away because we have so much to get through. So I'm going to head it over to our fearless leader, Liz Powell, and she's going to get us started.
Thanks, Vanessa. Appreciate that. Good to see you all. And the first thing I wanted to talk about, because there's been a lot going on in DC, and I actually just wrote up a summary of really the past 2 weeks. Last week was really rough as far as a lot of cuts and firing. So if you're interested in getting that summary, it's actually on our website at g2gconsulting.com under federal updates. So, and of course, you're welcome to email me directly, but there has been a lot going on. I have to say, just coming from the Hill, I'm actually in between Hill meetings now. I am getting a nice reception from both Democrats and Republicans about the need to address all these cuts. So I do think that there will be an opportunity to increase the research funding for breast cancer, for example, to work on these other things that are really harmful to health right now. So keep the faith. I just wanted to make sure I provided that overview. Right now, everyone is very obsessed with the budget. And so they've got to get this budget resolution. They now have the House and the Senate, but then they have to work on the details, the actual legislation, how they will fund these tax cuts and these other programs. Which means that the health and human service side of things will have to get cut, and many are concerned about Medicaid cuts. So we are tracking all that, and we'll keep sending updates and making sure folks understand what's going on and what is the lens we need to use to advance and raise awareness around breast cancer and policies and funding that impact breast cancer. So we're tracking that, and then they are starting the FY26 appropriations process with lots of deadlines hitting now, next week, next few weeks, and my team at GDG, we've been working furiously on that with the women's health advocates and our submissions there. So we are definitely trying to make sure that we have a presence and that we're talking about these issues. On happy note, we are seeing some legislation come out on breast cancer, and some of you are familiar with these already because they've been introduced before, but the Screens for Cancer Act, Metastatic Breast Cancer Access to Cancer Act, Women Veterans Cancer Care Coordination Act, and then the Triple Negative Breast Cancer Research and Education Act. Find It Early is our big one that we have been working on for a few years now. And I just connected with the staff for Congresswoman DeLauro, who's been the lead on that. And they are still waiting to get edits back. They're just doing final tweaks on it and plan to reintroduce that in a bipartisan fashion with Congressman Fitzpatrick in the House, and then in the Senate, Senators Klobuchar and Marshall. So in that vein, we are doing a congressional briefing to get people educated on this issue, on the importance of having access to the screening that you need for your tissue type. With 40 to 50% of women having dense breasts, that means that a mammogram alone will not find that cancer early. And if cancer's caught early, it's 99% survivable. So I think a lot of folks on the call know these numbers, but it's super, super important. And while, genetic and hereditary factors are important too across the board, it doesn't matter whether you have it or not in your genes. If you have dense breasts, you absolutely need this additional screening. So this is our briefing. These are the amazing speakers that we've got lined up. You can see their pictures and their titles. We also have started to post this in social media and to distribute through our mailings. So please help us spread the word. We want to get as many congressional folks to dial in as possible. We need to educate and raise awareness before we're going to get folks to sign on to legislation and to change policy. And ultimately, Find It Early Act is our huge number one focus, but very related to that are, what is USPSTF doing? What is HRSA doing? What are these other entities doing that are setting guidelines that doctors are following that could be limiting patient access? There's the insurance system, whether it's CMS, TRICARE, what have you. We need to make sure that we are holistically addressing it. And we absolutely care about that breast cancer journey and want to make sure that there are humane treatments available for patients. So that is what we're working on in DC. That's the little bit of the DC perspective. My colleague Madeline Stickley is going to close out at the end with an advocacy request for all of you. We're super excited to have you team up with us to drive turnout to this event. So she's going to cover that at the end of the slide. So thank you so much.
We are super excited that one of our leaders and amazing all-around woman, Andrea Wolf, is going to share with us a little bit about her personal experience and really what motivates her to be a part of this work.
Thank you so much, Vanessa. It's a pleasure and an honor to be here with all of you. As some of you know, my professional touch point with breast cancer is as the former CEO of the Brem Foundation, which is now led by the mighty Claire Doherty. But some might not know actually kind of how I got here and why I got here. So I'd love to share that with you. My breast cancer story started well before I was born. My grandmother was 33 when she was diagnosed with breast cancer. It was stage 4 metastatic disease. And she was told that she has 6 months to live, that she should wrap up her affairs. They were going to try. It was back when women who had this had radical mastectomies. There she is. That's my grandmother. Obviously, she didn't die. She was told she had 6 months to live. She came home. She told her kids. My mom at the time was 12. Her brother was 13 and her younger brother was 7. And they thought that was that. But she's a fighter. She did fine, did great. And then was diagnosed with ovarian cancer at age 49, also metastatic to the lungs. Same sort of not great prognosis. And then lived to be actually 74 and to see great grandchildren. My mom, I think it had a profound impact on my mother, who went to medical school, became a radiologist. She was the first in her family to actually ever go to college, let alone medical school, and had me in her 4th year of medical school when she was 24 years old. And one day when she was trying out new equipment on herself, she found her own breast cancer, right? And I was 12, just like she had been 12 when her mother was diagnosed. And so she had chemotherapy, obviously mastectomies, chemotherapy. And at that point, BRCA sort of prevalence knowledge had sort of burst onto the scene. And she got tested and she was BRCA positive, no surprise, because each of her and her mother had breast cancer in their 30s. So I got married pretty young. I had my first 2 kids when I was 24 and 28, respectively, both daughters. I now have 4 daughters, as you'll hear in a moment. And I really wanted to change the narrative. I kind of was pretty sure that I was going to also get breast cancer in my 30s. And so I had prophylactic double mastectomies when I was 30, in between my second daughter and my third daughter, all of whom you can see on the left here, dressed up to go to the Taylor Swift concert. And I just did it because I really wanted to do everything medically possible to change the narrative, to not be the 3rd generation of women to get, breast cancer. And so I joined the board of the Brem Foundation. I was a lawyer, not doing this kind of work at all. And I turned around 3 times and just something called me from above and said, like, really, you got to dedicate some serious time to this so that we can push early detection and we can push medical interventions at an early age for young women, for all women. But, my drive was for young women, so that we can take whatever knowledge we have, whatever technologies we have, and make it accessible, not just to people who know, but really to all women, because they deserve that. I continue this fight as a consultant now. I work with startup companies in this space, but I really continue this fight for my 4 daughters. And I'm really honored to be with you all as we continue to push these public policies that are going to make a humongous difference for a lot of people, as we also hold hands with and partner with the physicians who are on the battleground every day, and also the amazing innovators who are creating new technologies to make better prognoses for everybody. So thank you for having me, and let's rock on together so we can get this bill passed.
Thank you, Andrea. And, I just love seeing this picture because it is just such a great representation of, why we're all here, right? Whether it's for our own kids or the people, our sisters, our friends, our friends' friends, our future kids. So thank you so much for being here to share your personal experience. We really appreciate it.
Thank you.
I am going to now pass it along to one of our fearless leaders and steering committee members, Betsy Tower. We love to highlight what individuals are doing, but also what organizations are doing. So take it away, Betsy.
Thank you, Vanessa. Yeah, I'm proud to be on the steering committee. Jyoti Gupta is our president and CEO of Women's Health. She's in China today, but yeah, I've been at GE 17 years. I've been with GE Healthcare 3. We transitioned and became a standalone company in January of 2023, and women's health and all of the issues related to it is really my biggest passion at work. When we've been talking about the progress that we've been making in breast cancer, screening, the things that we, obviously highlight over the last couple of years are the national breast density notification that went into play. We all know about that. More women are finding out that they have dense breasts. As we know, 40 to 50% of women have dense breasts. And as they're finding out that they need additional screening, they're finding out about those high out-of-pocket costs. So if you go to the next slide, we've also been talking about the USPSTF and the guidelines that came out last year. We, GE Healthcare, I want to go to the next slide. We're one of many, organizations that sent comments back before the final guidelines came out. Obviously, everyone is pleased that they changed the recommended age from 50 to 40, but they missed the mark on a couple things, including breast density, that there was insufficient evidence. So, organizations pushed back. Like I said, GE Healthcare wrote a comment letter. I know, members on Capitol Hill pushed back and were disappointed. And so again, while more women are being screened, they did miss the mark on a couple things. So that's one thing we've been highlighting. And if you go to the next slide, the guidelines at ACR are encouraging that, identifying, women, we've been talking a lot about more women that are younger are getting diagnosed with breast cancer. So ACR, their guidelines that came out, recognizing the younger population and the risk factors and women being able to do risk assessments younger. And you guys, know most of this, but we'll move on to the next slide. So GE Healthcare, of course, we care about this because we're, in the entire breast cancer continuum space. We make everything from mammography systems. In fact, GE Healthcare has made the first one that allows the woman to hold a little toggle and actually control the pressure on her own breast, which has been determined to get a better image because the woman is in control. We make, automated breast ultrasound, everything through Cerianna for women who are later stages. But as we shift to advocacy, these are two of the champions that we've been working most closely with. As you know, Liz just mentioned, Delaro is leading the way on the Find It Early Act. And Congresswoman Debbie Wasserman Schultz, breast cancer survivor herself, is very passionate about this. And she's the reason that women between the ages of 40 and 49 have continued to be able in the last several years to get screened for mammograms through the Affordable Care Act because of the PALS Act that she had been leading. And if you go to the next slide. So, yeah, and you can let everything come here. So, I know that most of us know what the Find It Early Act is, but for anyone on this call today that's new to that, the purpose, of course, is to make sure that women don't have to decide between putting food on the table or finding out if they have breast cancer because they have dense breasts or they have other risk factors. And so the Find It Early Act covers all health insurance plans for that additional screening. So it's, Medicare, Medicaid, TRICARE for our servicewomen and women veterans, and then private insurance. And so, in that photo there, you see, who's introduced the bill in the past, and they're about to reintroduce Congresswoman Delaro from Connecticut and Brian Fitzpatrick standing next to Katie Couric there. He's from Pennsylvania. And then in the far left, I just want to mention Joanne Pushkin, who is a warrior. She's a big part of the reason that we have, the breast density notification law in place. She worked on that for many, many years. And she's also the reason that we have World Dense Breast Day, which is, I think, the third Thursday in September every year. But so, great momentum last time. There were 69 co-sponsors. We're going to do everything we can once it's introduced to help get those co-sponsors up higher than that. And of course, in the Senate, once that's introduced on the Senate, it's a little trickier. It's going to have to be partnered co-sponsors. So a Republican and a Democrat need to come together when they co-sponsor. So we will do everything we can to talk to members and make the case for this and get them to co-sponsor and really move this forward. Next slide. These are, I had my intern put this together, which is a great slide. These are all of the organizations that we're aware of. If you are a part of an organization that supports the Find It Early and you don't see your logo here, let us know and we will add it. But, this is a groundswell. This is, so many people just call it a no-brainer. Why would women have to pay out-of-pocket costs? We know that 99% of breast cancers are curable if they're found early. So that is the whole point of this legislation. And if you go to the next slide, just really quick, some of the things that we've been doing, as GE Healthcare, we did a congressional briefing 2 years ago on World Dense Breast Day. You can see Dr. Brem there was our wonderful speaker. And we had a woman from the Disabled American Veterans, and then Delaro and, Debbie Wasserman Schultz both spoke. We'll go to the next slide. And then this is just us advocating on Capitol Hill last year on the day of the Congressional Women's Softball game that happens every year that raises money for the Young Survival Coalition. GE Healthcare brought our breast imaging van to Capitol Hill. We had it in the outfield at the game. You can see on the bottom left there, we had Congresswoman Lori Trahan of Massachusetts. And then we had Brian Stile and Ron Estes, Republicans from Wisconsin and Kansas on the van, and we're just doing everything we can to get the word out on breast cancer. And lastly, in Wisconsin, we're working closely with Komen and a group of folks that you can see on the far left there. We formed a coalition a few years ago, and this is our third time we're close to introducing it. We sadly lost our patient advocate last year, Gail Zemer. And so we're calling it Gail's bill, and we're fighting like hell to get it done. This is the third time. We got close last time, but there was somebody that put in an amendment about ultrasound only, and that's not what we wanted. So we had to pull it as a coalition. But we have great champions in place. We're getting ready to introduce it, and like I said, we're going to fight like hell in Gail's honor to get it over the finish line. So we are proud, GE Healthcare, to partner with all of you to be on the steering committee, and I will hand it back over to Vanessa. Thank you for the opportunity.
Thanks, Betsy. I loved seeing, I'm going to actually, because I'm in control of the slides, I can go back, but I loved this picture of advocating on Capitol Hill because it just is such a reminder that it takes everyone, right? In all different ways of speaking up and coming together. And, sometimes people think of GE and they don't necessarily think of breast cancer, right? But it's a reminder to us that organizations like yours are out there doing really, really wonderful work. And from someone who was diagnosed young, twice under the age of 40, this is just so important. So thank you so much for being here to share. We
Thank
are
you.
going to move on to our advocacy actions, and Madeline is going to share with us a little bit. Madeline, are you there?
Hi there.
Hi.
You should be here.
Okay,
Can
good.
everybody hear me okay?
Yep.
Awesome. So here we're welcome you to join us in advocacy. Here's some instructions to ask your member of Congress to send their health staff to attend the briefing, which is online, so very easy to attend. And I've already been sending them the Zoom registration link to their emails many times, and I will continue to do so until we get to April 23rd, because these people get so many emails, so you have to just keep repeating and repeating to get through. So if you go to house.gov or senate.gov, you'll be able to look up your member of Congress by entering your zip code and then possibly your address, because House districts are drawn in very funky ways, to see who your member of Congress is. And it'll be able to direct you to their website where you can send them a message or you can call them and ask their office about this as well. Same thing for Senate. And we'd like for you to please share this invitation of why breast cancer early detection is important to you. Tell them a little bit about our briefing, and encourage them to register. And you can also explain that breast cancer is 99% survivable when it's caught early, and also much less expensive to treat when caught at that early stage. We can talk about a little bit of our speakers who will be on the briefing, and just reiterate how it's important to you, and emphasize that this is an online briefing and hopefully easy to join. Thank you. And of course, you're welcome to email me with any questions on this. I'll put my email in the chat.
Awesome. Thank you so much, Madeline. So we wanted to highlight some events that are coming up. Of course, the big one that we're pushing right now is the April 23rd. But of course, we also want to support the people that are a part of this coalition, because we are not in competition. We are in collaboration. And one of our amazing leaders is from the Brem Foundation, which we heard from Andrea, who her mother started this. So Claire, I don't know if you want to jump on and share a little bit about the Empower Hour that's coming up.
Yes, thank you so much, Vanessa. I'll be brief. We're just 3 weeks out from DC's sort of signature breast cancer early detection event. It's called Empower Hour, taking place on April 30th at the Salamander. The focus of the event this year is the power of artificial intelligence to advance early detection of breast cancer. And our keynote speaker is Allison White, who is sort of a leader in a VC firm supporting early detection. We have a great lineup of speakers. We'll be honoring Kristen Dahlgren and Chairwoman Jocelyn Pena-Melnick from the Maryland General Assembly. Tickets are still available. You can see the link there in the bottom left. Go to tinyurl.com /Empower Hour 2025. We have a range of amazing sponsors that you can see here at the bottom, but we are certainly looking to pull in everyone. It's going to be a great day advocating or sort of bringing together advocates, leaders, corporate partners, and anybody and everybody interested in early detection of breast cancer. So I'll leave it there, but thank you all.
Thanks so much. That looks like an amazing event. And some of the other events that are coming up, April 18th, the Susan G. Komen Foundation is having their Hill Advocacy Day. Of course, April 23rd, please, please, please reach out to your representatives and join online so you can be a part of that. April 29th, we're doing the CMS reimbursement congressional briefing and how it impacts women's health. I had the privilege of sitting in on a call yesterday and being a fly on the wall of what's going to happen at that in-person congressional briefing, and it is really going to be powerful. April 30th, the Brem Foundation, and then May 21st, the Women's Health Advocates Capitol Hill Day, which we are excited about and we're getting ready for. So we just wanted to say thank you for showing up today. We know everyone has busy schedules, and signing on in the middle of the day, in the middle of the week is a big deal. So we appreciate you being here. But more importantly, we appreciate you leaving here and spreading the word. So please email us if you have any questions. Stay up to date on all of our events and connect with us on LinkedIn.